Discuss the clinical features, investigations, and management of Sjogren syndrome, or it can be asked as keratoconjunctivitis sicca. Sjogren syndrome is an autoimmune disorder of unknown etiology characterized by lymphocytic infiltration of exocrine glands leading to glandular fibrosis and exocrine failure. Salivary and lacrimal glands are commonly involved. Sjogren's syndrome can be classified into primary SS, that is Sjogren syndrome, or secondary SS, that is secondary Sjogren. Primary Sjogren syndrome is not associated with other diseases. Secondary SS occurs as complication of other rheumatic disorders such as rheumatoid arthritis, SLE, polymyositis, or scleroderma. Clinical features: patients are generally old, mean age 50 years, and more than 90% are women. Exocrine gland involvement: dry eyes, keratoconjunctivitis sicca, occurs due to lacrimal gland involvement. The ocular symptoms of dry eyes are irritation, grittiness, and a foreign body sensation. Conjunctivitis and blepharitis are frequent, but keratitis can occur also. Dry mouth, xerostomia, occurs due to salivary gland involvement. Salivary glands may be enlarged. Decreased salivary secretion leads to difficulty swallowing dry food without water. Oral dryness leads to increased risk of dental caries and periodontal diseases. Vaginal dryness can lead to dyspareunia. Exocrine gland involvement in the skin may lead to xerosis. Extraglandular features include musculoskeletal system, non-erosive arthritis, nervous system, peripheral neuropathy, kidneys, glomerulonephritis, renal tubular acidosis, heart, pericarditis, RS, interstitial lung disease, GIT, dysphagia, lymphadenopathy, thyroid, hypothyroidism, vascular, vasculitis, Raynaud's phenomenon, increased incidence of lymphoma, low grade fever, fatigue. Investigations: anemia, leukopenia, thrombocytopenia, elevated ESR, cryoglobulinemia, cryoglobulinemia, autoantibodies, ANA, and rheumatoid factor are usually positive. Other antibodies such which can be present are SSA anti-RO, SSB anti-LA, and gastric parietal cell antibodies. Schirmer test: it is done by placing absorbent paper strips in the lower lacrimal sac for 5 minutes. Less than 5 mm of wetting is abnormal. Biopsy: diagnosis can be confirmed by finding lymphocytic infiltrate in the minor salivary glands on lip biopsy. Management: artificial lubrication is the mainstay of symptomatic treatment. Artificial tears such as hypromellose drops can be used for the eyes. Occlusion of the lacrimal ducts can increase the tear content of the eyes. Artificial saliva and oral gels can be tried for xerostomia. Stimulation of saliva flow by sugar-free chewing gum or lozenges may be helpful. Oral hygiene is important to prevent caries and gum problems. Vaginal dryness is treated with lubricants such as KY jelly. Extraglandular manifestations can be treated by steroids and immunosuppressive drugs such as azathioprine. Immunosuppression has no effect on Zika symptoms.